So here I would be in the med room. Of course, I would do hand hygiene. And then once I do that, I go ahead and get my cap. I open it carefully. Set it down. Go ahead and get my flush. And I connect. And once it is connect, I go ahead and prime it by pushing all the air out. So I do push a little less than 2 milliliters. Okay, and then once this is prepared, I'm ready to go ahead and go to my patient's room. Okay, so I'm gonna go ahead and enter my patient's room. Hi, good afternoon. My name is Laura. I'm gonna be your nurse today. Can I please have your name and your date of birth?
Jane Doe, January 14, 73.
Okay, so I would go ahead and verify that with my mark and the patient's bracelet. I'll go ahead and do hand hygiene. And what I'm gonna go ahead and do, I'm gonna go ahead and clean my table. And today, ma'am, what I am gonna do, I am gonna go ahead and we're gonna change the caps of your central line. We're gonna change the caps, we're gonna change the dressing, and we are gonna go ahead and remove the catheter. I am gonna give you several instructions. I'm gonna let you know at a certain point that you will have to turn your head. You will have to turn your head to go ahead and avoid contamination the most that we can when I am doing the changes. Also, I'm gonna ask you to lay flat, and I am gonna take the pillow away from you for a while we are doing this procedure. Do you have any questions? Are you okay with everything?
Yes, that's fine.
Okay. So what I'm gonna go ahead and do now, I'm gonna go ahead and put on my gloves. I did perform hand hygiene. Okay, I put on my mask. Okay, ma'am. So after this, I'm gonna go ahead and assess the site. I go ahead and palpate. I make sure that there's no crepitus, that there's no signs of infection. Do you feel any pain while I touch you, ma'am?
No.
Okay, so there is no swelling, no pain. There is no signs of infection. You see, okay, there is no redness, no discharge, there's no JVD, no swelling. Okay, so now what I do, I go ahead and choose the port that I'm gonna change. And for the rest of this procedure now, I'm gonna ask you to turn your head, and that's to avoid any contamination while I'm changing the top. So I'm gonna go ahead and choose this one. The patient already turned her head over to the other side. So I am gonna ask you to hold your breath, ma'am. At the count of 3, go ahead and hold your breath. 1, 2, 3, please hold it for me. Okay, go ahead and breathe for me. Thank you. So now I am gonna go ahead and flush the line. Okay. And I go ahead and remove my flush. I clamp. And then I would go ahead and take off my gloves and perform hand hygiene. So I had already verified my patient. I've already laid my patient down flat, removed the pillow, asked them to turn the other way, verified my patient, verified that the IV side is free of infection, free of subcutaneous crepitus. So I pretty much just made sure that her vitals and everything are fine. So then now what I'm gonna do, I'm gonna get my alcohol swab and start removing the tegaderm. and I'm just gonna go ahead and remove it as gentle as possible. Okay, so I'm removing it. Okay, and I do remove from the outside in. So once it is removed, let's say it's all removed already, so I would dispose of the alcohol swab, and this would be sutured in, but I would still kind of like hold it stable and pull the tegaderm out. And before I fully pull out, I'm gonna open my 4x4. So I would open it carefully like this and place it on the table. Okay, and now that I have it here, I would fully remove the tegaderm, look at it. So I would look at the biopatch. I would inspect the biopatch for coca at this point. Make sure that there's no funky smells, any abnormal drainage. So then once I do that, I dispose of it in the biohazard, and then I would go ahead and grab my gauze and place it over. And at this point, I would go ahead and remove my gloves, perform hand hygiene, and get ready to prepare my sterile field. Okay, so I would perform hand hygiene first, and then I would go ahead and clean the table, and then I would get my supplies. I have my suture kit, I have my central line dressing change, and I have my bio patch here. So I'm gonna go ahead and open my suture kit first. So I check the integrity and everything on the package, and it looks fine. So then I go ahead and open it, place it on my table, and then I get my central line dressing change. I check the integrity again and check that everything's fine with it, and then I go ahead and open it carefully. Okay, and then we do not have a bio patch, so I'm going to be using a small alcohol prep. So what I would do is I would go ahead and open my bio patch carefully and place it in my sterile field. So we're going to pretend not we're doing that. Okay, and now I'm going to go ahead and pull out my mask. And since I am already wearing a mask, I'm just going to go ahead and dispose of this one. And then, so if that would happen, I would just go ahead and dispose the kit and get a new kit and get everything out again, start all over. So for the purpose of this video, I'm going to go ahead and take out my gloves gently, place them on my table. So then now I go ahead and take my sheet out. I'm going to go ahead and place it shiny side down. And then from here on, go ahead and go up. And then I will dispose of this. So now I go ahead and take my iodine swabs out, place them on my sterile field, my alcohol swabs, place those on the sterile field, my gauze. So this one, it would come out differently, but since we are using the kit, I'm going to go ahead and just use this one, and I would fold it. This one is already folded, and I put it here. I get my bio patch. So then this would be my bio patch. It would already be open. Go ahead and place it on my sterile field. And then I get my cross, put it on my sterile field. My targeter, my sterile field. And then my measurement tape. So then this one I'm going to go ahead and fold it at the 0 mark. And stretch it up. Okay. My tape. And the tweezers for the. Okay. So at this point, I'm going to go ahead and do the cleaning. I'm going to take off the 4x4 that my patient did have and dispose of it on my biohazard bag. I would have it off to the side. So then here I go ahead and grab my alcohol swab. So I get one and I clean from the inside out. I make sure that there's enough friction going on. I would go ahead and dispose of this and then get another one. So this would be a new one and then I would clean. Dispose of it. Get a new one and then clean. Okay. So I would dispose of this one as well, but we are reusing the kit. But this one would be disposed of. And then now I go ahead and clean with iodine. So I would at this point stop and ask my patient if the patient is allergic to iodine. If there is no, then I would go ahead and do it. So I do get the iodine. I open it, get out the first swab, and clean again from the inside out in a circular motion, making sure that everything's clean. Dispose of this. I would dispose of it and then get out the other one. So this would be the second cleaning. Dispose. And I would not be going around the patient, of course. So I would be disposing it, disposing of it, and then I would get the third one. So this would be the third clean. Dispose of it. So this would be disposed. And then at this point, and if I'm just gonna go ahead and do a dressing change, I would go ahead and get my bio patch, which is this. I would place the bio patch in a way that whenever I do remove the dressing, it's not gonna get caught or it's not gonna affect the line in any way. So I would place the bio patch on the line. And then I would get my titer, put it on top of it, and then of course label it with my initials, the time and the hour that the dressing change was made. Okay? And if this, in this case being, so we are removing, so at this point, everything's clean. So what I'm doing now is I'm going to go ahead and grab my scissors from my pack. So I'm go ahead and get this. I don't need this, so I'm going to go ahead and dispose of it. I don't need this, so I'm going to go ahead and dispose of it. And I'm going to go ahead and get my tweezers and my scissors. And at this point, I'm going to go ahead and secure the line. And I would go ahead and secure it and cut the suture, secure it and cut the suture, secure it and cut the suture, and then dispose of these. So these would be disposed of. And then once everything is cut, at this point I do go ahead and get my other box and I would place pressure. And before I did all this, I did remove the pillow from my patient. My patient is flat, and at this point, he was facing the other way. So now I'm gonna go ahead and ask my patient to take a deep breath. So please go ahead and take a deep breath for me. And when they do, I'm sorry, before they do that, I'm so sorry. So before I do that, I'm gonna go ahead and before I put the pressure, I'm gonna go ahead and get my measuring tape. And I measure how far it is in centimeters from the line to the hub. I would measure it, dispose of it of course, and then now I would go ahead and put the pressure. So then I would go ahead and ask my patient to take a deep breath. So can you please take a deep breath for me, ma'am? And then I would pull up the line in one fast motion, put pressure on the patient's chest, well, the incision. I would put pressure, and then I would get my Tegaderm and cover it, label it with the time, the date, and my initials. So then now I would have the line out. So what I do is I inspect the line to see that the catheter is full, that the tip, that the whole tip came out, that there's nothing left inside the patient. I would inspect the integrity of it. Of course, I would assess my patient, ask my patient if he needs anything, and assess the area again. What else? And that would be it. Take a vital, set of vitals, educate my patient. So then after this, I would go ahead and take off my gloves, perform hand hygiene, and leave the room.